If you have stenosis or spondylolisthesis or even degenerative disc disease, this can be really helpful for you. This week, I'm going to tell you about a setback I experienced with my back and my process for getting out of the setback or returning to my normal life. But I do want to tell a little story of what happened, just to give you some background information. I decided to get a full body massage. He's being quite aggressive, doing some thrusts on my spine. And after the massage, I felt pretty loose. Maybe like a little bit too loose in my lumbar spine, in my lower back, right about there. And that's the vertebrae that I've in my past dealt with where I had an instability and it was very shifty and just for many years, very uncomfortable area. And I think that instability kind of got loosened up a little bit. And so I was actually having some sciatic symptoms from my setback, which is not a fun thing. It's a little bit of a scary thing. So it's going to be, I think, a few weeks before I'm back to normal. And I'm grateful that I can say that because I know that I have the tools to be able to recover. And so I thought I would share with you the types of things I'm doing. I wrote some stuff down. This is the list of the things that I'm doing. And actually, I did save mindset for last because it's the most important. I usually say 90% of the battle of getting out of the back pain cycle comes down to mindset. For me, in my particular history, I'll give you a little bit of background. I already mentioned that part of it is instability. So one of my vertebrae moved too much in my history for years. This is the pelvis. This is the rib cage. So you have the spine here, and you can just imagine that typically what happens is that vertebrae for me moves forward. It's called a spondylolisthesis. It's not an uncommon condition for the spine. And you can just imagine this vertebrae, mine's an L5, but this is L4 we're going to use for the example. It's just shifting too much and typically gets pushed that way. And it's also getting pulled that way by the hip flexor muscles. That muscle group attaches directly to the vertebrae of the lumbar spine. And when it's tight, when this muscle group is tight, it's pulling on those vertebrae, pulling forward, pulling you into anterior pelvic tilt, pulling you into a stenosis position if you have stenosis, as I do and did. When these muscles get tight, they are going to be not helping your cause. And one of the things I do with the floor is I have this in the program is I use a pillow. I lay on the floor. So this is somebody that's face down. Okay. I take a pillow and I place it right there. What this does is this actually has an upward pressure on my vertebrae. You can imagine. So it's actually blocking my vertebrae from getting pulled down into that vulnerable position, into stenosis, into just a chronic extension position. And I just breathe. Lay over the pillow and I just breathe. So if you have stenosis or spondylolisthesis or even degenerative disc disease, which is a result of those other conditions, it's just the wear and tear on the discs from stuff like this, then this can be really helpful for you. Spend at least 15 minutes in this position and just breathe over the pillow. And you can use a really thick pillow. The thicker, the more pressure it's going to push up. It can allow those lower back muscles to relax and let go and just be an excellent form of relief. I do this, it feels good. I start my day with a little bit of this. Another thing I do on the floor is I not only just lay on and get down on, but be performing active exercises to activate the muscles in your core. And we're going to talk more about that when we talk about the back anchor and the front anchors down below here. So breath, using my breath not only for this laying over the pillow relief position, but it's a pretty simple concept. Just make sure you give it at least 15 minutes to let those muscles let go. When you have a setback, your body goes into the protective mode, protective state, and muscles hold on, they grip. And it takes time. And the nervous system can act very slowly and have delayed reaction. So it takes time for those muscles and the neuromuscular system to kind of release and feel safe enough to let go. And that's what we want because we need the blood to flow through there. And we need to create healthy patterns rather than those protective positions that are trying to bring us into the fetal position and are keeping us in the cycle. Breath is extremely powerful for that. You cannot take deep breaths if you feel unsafe. The more unsafe we are, the more rapid our breathing becomes. You can override that system of being in the protective position by taking deep breaths. And so that's what yoga and meditation is. Take deep breaths and it tells your body that you are safe. I'm using breath all day long. The way that we teach in the program, that's what I'm doing. I'm breathing into my lower back, creating space, creating decompression, creating intra-abdominal pressure to stabilize my spine so that my protective muscles, like the hip flexors, can let go because they're causing my problem. Remember, they're pulling my spine into the position that I don't want it to be in. Number 3, sit less, self-explanatory. Sitting is not good for anyone. It may feel okay for some people, but in my case, it doesn't. Sitting doesn't feel good, especially if I'm in a setback. So I just do less of what's hurting and I do more of what's helping. My movement when I have a setback is low level, light activity, like walking, or low level activities around the yard or around the house. Slow, gentle movement and keep that body moving. 5, float. I'm lucky enough to have a hot tub. I get in the hot tub and I float. Buoyancy, decompress. You can float in anything. Bathtub, lake, swimming pool, ocean. It doesn't have to be hot. Actually, the next one is heat and cold. I don't know. I've never really decided what I think is more valuable between heat and cold. I love both of them. I use heat with the hot tub, but I use cold with cold showers. It's one of the most effective things that I do to reset. So alternating or just whenever you can, change the temperature. Get uncomfortable. The bridge is the best exercise on the planet if you do it the right way, and it's also the most commonly wrongly done exercise. So when done the right way, it's one of the most valuable exercises on the planet for lengthening your hip flexors. Instead of just stretching them passively, like with a kneeling hip flexor stretch, the bridge is much more effective for long-term benefits. Now, down to the bottom of the list, the back anchor. I use the back anchor for relief, connecting to the back anchor for me, and even doing the back anchor progression. It just feels like it kind of decompresses my spine. So the front anchors I don't really use for relief. That's because it's actually more of a challenge for me, but it helps to lengthen my hip flexors. My legs would be here, and I'm keeping my pubic bone connected to the floor, and I'm pressing away from it to elevate my legs, which is lengthening these hip flexor muscles. So it's an active way to lengthen my hip flexors and keep my spine stabilized. So if you're in the program, you know what I'm talking about. In my journey of back pain, I used the anchors to get out of pain, and then they kind of got integrated into my natural movement, and I didn't really have to think about them as much. And I can do more natural activities the way you normally do because they're integrated. But when I have the setback, I'm consciously thinking about them more, and I'm going a little harder on my connections to protect my spine. And so I am doing more conscious front and back anchors in everything that I do during a setback, because that's the whole point in this program, is integrating the anchors into the activities of your daily life. And ideally, those are the activities that you love most. I'm torn between doing what I love and risking having back pain forever. This is where I was for many years. Am I going to be like this forever? Am I going to be in a wheelchair? I had a chiropractor tell me that if I didn't change something, that I'd be in a wheelchair by the time I was 30. Can you imagine how that had an impact on my psyche? Major psychological impact on me to hear that from a healthcare professional in a white coat. Needless to say, I never ended up in a wheelchair, but having that in my mind affected my progress. And so the main thing I want to say about mindset is that when you have a setback, and especially if you don't confidently know that you have the tools to get out of it, it can lead to a lot of anxiety about the future. Anxiety is one of the mindsets that keep us in what's called a sympathetic state, which is the same thing as the protective state of being, or protective mode. And that's where the muscles are going to tighten up and try and protect you, the protective muscles. They're bringing us into the fetal position. And so it's incredibly important to be able to get out of protective mode, because protective mode is not growth mode. You cannot be in growth mode, which would be progress, and protective mode, which is defense, at the same time. The body is in one or the other, sympathetic or parasympathetic. Having those feelings of anxiety are natural and understandable, but they're also keeping us in the cycle. We talked about using the breath to override these systems of protection is not only with your breath, but also practicing gratitude. Gratitude for me, I believe, has been one of the most life-changing mental practices that I've adopted. And I feel that when something like a setback happens, it's really easy to get into kind of a catastrophizing behavior or mindset of, oh man, this is terrible. Everything's going wrong. What's my future going to be like? That can be stopped very powerfully by thinking about the things that you're grateful for, the things that you have, the opportunities that you have to be able to address this challenge. It's another challenge, which is an opportunity to learn and grow and make progress. A practice that I have with my wife is that before we take a bite of food, we say what we're grateful for. And so that is something that I just want to share with you, because if you have a setback, I think it's one of the most powerful tools you can use is gratitude and mindset. And so what I want to say to you is, no, you're not going to have back pain forever. Yes, you can get back to the things that you love, and you should get back to the things that you love.
We appreciate you here at Core Balance Training for leaning into your health, and we'll see you again next week.